I want to welcome everyone to AHIP 360. This is a new enterprise for us, so we're delighted to have Eugene join us to be the first interviewee and to be in the first interview of the AHIP 360. I think everybody's energized after that wonderfully inspiring first session, and it's all about customer service. And I can't think of anyone who is better suited to actually be here to just pick up from that theme. Let me introduce Eugene Sayan, who's CEO and President of Softheon. He's the founder, chairman, and chief executive officer, and responsible, obviously, in that role and capacity, the vision and strategic direction of the company. His solutions have been adopted by payers, providers, and government agencies for more than 25 years. The company really established its footprint very significantly during the entire rollout process for the Massachusetts exchange. So he comes to the federal and state exchanges in the new market with a considerable amount of experience. So Eugene, thank you for doing this. We're delighted you're here, and I want to welcome you to our 360. So first question for you, now that the new marketplace is live in 2014, what are the biggest opportunities for health plans and all of the people here in their capacity to provide value, in your view?
Sure. Well, foremost, thank you, Karen.
Sure.
This is truly an honor and privilege, and we are definitely grateful for all the wonderful things that AHIP and you are leading the industry, if you will. Clearly, as you are witnessing, on a day-to-day basis, that there is a transformation and an innovation taking place in the way the healthcare systems are being serviced and delivered altogether. So we believe that the transformation is in the best interest of really, truly a win-win-win proposition altogether. And clearly, we are delighted to be in the epicenter of that transformation. And the technology is truly one of the cornerstone of that transformation, combined with the consumer demand. And now we have this, for good, better, ugly, a thing called ACA. It's a mandate. It's kind of a forceful transformation. We know broccoli is good for us. We all have to eat it a little bit, and even though it may not taste well at first. So we are truly delighted to be in that kind of a setting altogether, working with so many payers, so working with various state agencies, as well as the CMS at the federal level.
So the ACA is clearly putting the health plan community in the customer service space. What does Softheon do particularly to help support a health plan? Take us through that so people can get their hands around exactly what you do for them.
Sure. So as we see the transformation towards a consumerism aspect to it altogether, the biggest challenges that we see across the industry that for the systems that are being put in place, the technology and processes, even to a certain extent the people put in processes, it has been mainly about cost containment and more towards the delivery and everything else. But now the consumers we're seeing the early signs of being engaged, being a stakeholder in their well-being altogether. So that comes in two ways. We are seeing our health plans that has been traditionally Medicaid space serving to a constituent based on entitlement of receiving those health benefits. So versus someone now making a monthly premiums, calling and demanding better product and services. So where we see our biggest value proposition working with health plans, creating that real-time interactivity, looking at that screen and being able to tell to the member about, yes, we have received your payment, so you should be able to get those services from your provider or pharmacy. So what we're seeing is that the technology is becoming more real-time, more point of service where the information is truly needed. And the bottom line of that activity, obviously, this goes back to what I would call the member level P&L. So we need to be able to understand the utilization, and we need to be able to correlate that against the revenues. So it's the risk management versus the traditional ways of basically a leverage-based business models. We're seeing the consumers are being demanding better product and services, just as they have been very much spoiled to a certain extent from financial services and banking, even property casualty and life companies. So we're seeing that kind of a consumer behavior, especially being augmented by the ACA as well as the general, the empowerment of the consumers with various products and services like social media.
So you're actually talking about an enlargement of this concept of customer service in terms of how the health plan meets the consumer in this different times, in different places, and in different ways. And how does your experience, or what does your experience tell you about what you've learned about what health plans should think about as they approach these new challenges you're talking about?
Sure. So the consumer is a quite wider range. We have basically members around 18 to 65 years old, 63 years old age group, and they exhibit different behavior patterns. We're finding that basically your 18 to 35 category wants to be interacting with a consumer customer service activities on a self-serve model. So they are very comfortable navigating through the web portals. So they in fact prefer to log on to their quote-unquote private exchange portals that able to get all that information at a time or a place and the location where they feel is the best suited. It could be during their lunch breaks, it could be after hours. So your traditional business model of 9 to 6, if you will, it really has to be reevaluated. On the mainstream market basis, we're seeing a new business processes and new controls needs to be established. One great example, for instance, now that our members are in a premium billing mode, so they have to make monthly payments, we are now in the position of receiving those funds. One of our product and services, it handles the overall collection of that monthly premiums from the members. Payment methods is critical to us. To our surprise, that over 65% of our members pay their monthly bills via credit card transaction.
What did you expect?
Well, from our prior experience working in Massachusetts over 5 years, we had that number in basically low teens. I mean, it was not even anything beyond 27% of the population wasn't using internet as a portal in the same exchange settings. With ACA, with certain marketing, I guess, the outreach programs has been put in place, 65% of card acceptance is something that really no one was expecting. So we think that this is the trend going forward. For instance, now we are deploying our IVR-based payment platforms because, again, certain demographic does not want to use internet and leave their credit card numbers on the portal.
So they're worried about security.
Correct.
Right.
So to address those needs, rather than our model overall, this is our belief, this is our culture, outsourcing these tasks to overseas. We love to use the technology. We want to create robots. Rather than shipping those jobs, we want to be able to create a technology in the best effective way. So for instance, one thing what we've done is we now have an IVR-based payment portal.
And explain that.
It's basically a phone-based,
okay.
So you can call the customer service, and if you say, I would like to make a payment, you are then able to transfer to basically a computer-driven phone, all automatic. Another big initiatives, we have a certain demographics, they don't like to use internet, but they are on their mobile phone all the time. So we are deploying mobile payment platforms that you can get an alert on your iPhone or Android to say, your payment is due, click here to make a payment. So it's a very unique, very creative ways that we are looking to engage the consumer, providing on the best service we can. Of course, all these services, by the way, is all white label. It's all branded with our carriers. So we want them to win because when our carriers win, we win along the way, so does the consumer.
And let me follow that up. So when you talk about a white label, meaning that it's then labeled, it becomes the carrier itself's operation. In other words, that's what the consumer sees.
Of course.
So carrier ABC, XYZ, et cetera, et cetera.
Absolutely. All our products are being branded with our carriers in mind. So we have for instance, a MedWise mobile app. We have a MedWise IVR contact center. We have a MedWise portal. So consumer doesn't see us. They continue to see the health plan, the company that they have done business, and we are basically the delivery. We are what I would call this, maybe I skipped that part a little earlier. We see the healthcare turning into a retail-oriented, typical supply chain model. So in that world, we are the wholesaler in essence. And we feed this data using different channels, using different retail experiences to the different memberships based on their preference.
And you connect, as I understand it, so let me make sure I'm right about this. And if this is true, I want to talk to you about the importance of doing this. You connect the enrollment functions, the underwriting functions, and the customer service functions together for a health plan.
That is correct.
And in your experience, why is that important to connect those dots as opposed to necessarily having them in silos?
Sure. I think this goes back to the very first question that you asked about the transformation and then the consumer behavior. If you are on the phone, you're talking to a member, their question could be about their eligibility, enrollment. I have a newborn, I want to add it to my policy, so you need to be able to basically create and build together an enrollment underwriting processes in real time, pretty much. Or it could be about their payments. Have you received my payments? I'm at my doctor's office now. He or she is declining because it appears that I am now, my pay-through date is not being updated in your system, so they are declining providing those services to us. Or it could be something pertaining to about overall experiencing with, let it be on the claim side. So the typical silo approach is no longer applicable if you want to be able to create that unified consumer-facing transaction. I will even take it one step further. It doesn't have to be even, once again, talking to a customer service representative. I could be on a self-serve on a portal. I want to be able to carry my conversation, something that I see on the portal, transfer it to a CSR and explain to me why that is the case. Or it could be very well on a mobile platform that I see something as a consumer that I would like to discuss and talk to somebody. So what we are seeing is that both the depth and the breadth of these, breadth is in the sense of different channels, the depth, the functionality, capabilities, it has to be totally integrated across all these disparate systems.
It's almost as if you can say that you have to be very agile in creating this responsive culture to meet the consumer where they are.
Absolutely, absolutely. I think the key thing is being that just the nature of the business that we are in, we cannot tell a member, wait in the doctor's office and we'll get back to you in 3 hours. Right. That is not acceptable. Right. So we need to build, and that's what we have done. We have done 14 years of technology and R&D. We have been fortunate enough to have the opportunity to kind of put it all together and present it to our carriers. And on that note, by the way, that not only what we do is also how we do it. We do all these products and services without even setting a foot to our carrier's data center. We don't ask them to buy any hardware or software, or not to take anything away from our friends, but even a consultant.
They just plug in.
That's correct, ma'am. It's a true cloud computing in action, if you will, with tangible, proven track record. So that's the exciting part about us.
I want to just invite, if there's any questions for Eugene. It's a great opportunity to have someone who's been working on the front lines. So, Steve, do you have a question? You were just scratching your head. No worries. Any questions? So what, I guess I'll ask another one. What is the most important thing you have learned in going from the transition from Massachusetts to the new market? It's, obviously that 5 years made a difference in terms of technical sophistication and our ability to do things on the internet and so on and so forth. But if you could summarize, what's the most important thing you've learned in that time?
I think the business transformation is already happening, and clearly the consumers are in the driving seat. They want to be in the driving seat. So it is our kind of fiduciary responsibility to give them that empowerment what they need. That's the first takeaway. The second one is the technology doesn't have to be complicated. Okay, to be frank with you, I think any fool can build a complex system. The challenge is building a system that is simple enough so that as we drive our cars, we put the keys in the ignitions, we don't look under the hood how this car operates. That is the way the technology has to position itself and has to be delivered itself. And thirdly, the behavior on the business community has to change from what I would call the owner-operator to the governor of these systems, because many products and technologies today now in the hands of highly specialized organizations like Softheon being one of them, and we have about several hundred vendors in here. I think these products and services are now becoming available to you in the cloud being the metaphoric term that does not have to be within your four walls. So the CIO, CFO, COOs now has to really reevaluate their business model from initial acquisitions and amortizations to pay by the drink model. And that is a big paradigm shift from a CIO used to have these assets in their four walls and they knew what they had it. Now they are the governor of these assets that infinitely available to them. Obviously, that's going to require some kind of the thought process modification, if you will, rather than the first reaction, oh, let me build it for you, to look out who's available, who can bring me that product and services in a guaranteed manner, with the service level agreements that I can actually still be in a controlling driving seat. I don't have to procure that expense and hence for the risk of getting trapped on long implementation cycles, FTE, the increases on my staff, and unforeseen. In fact, the one thing that we've seen health plans spend upwards of multiple millions of dollars, ended up enrolling few hundred or thousand members through ACAs. And so they are now in this ROI predicament. Should I stay in ACA exchanges or should I exit? Because this is not something that I can actually continue to be sustained, if you will. Whereas the cloud model, what I call a pay by the drink model, you only pay for the services that you need to help us or provide services to those few hundred people that you may. Next year, if the number goes up, your phone bills may go up slightly, but it will be in proportional to the revenues that you're receiving through that channels, not something that you have to invest and try to recoup later on.
Listening to you answer that question about what you've learned and what you've observed, actually, and some of your specific remarks invited the follow-up question of, if there's one thing that from your experience you see perhaps people are doing wrong, what would that be?
I think my third point, probably from our carrier's perspective, that's what we have done. That's what they have done that's what made them successful in the first place. It's really difficult to give up your old habits.
And by that you mean aggressive builds.
Exactly.
Inside.
So, exactly. We're going to build the resources. We want to be in control of our own destiny. I think that technology has changed and transformed our lives in so many different ways. We as a consumers, we see this every day. I will be surprised how many tweets are being sent out as we speak right now. It's something that it was not in our dictionary up until 5 years ago. So the transformation and use of technology following Moore's law is accelerating as we become more and more reliant upon this technology. And I think the key thing that I would like to leave some of our audience, it may be time for you to go back and reevaluate the business model that made you successful. What worked for you may not work for you for the next 5-10 years.
I think you've done a great job of taking us from how you began in Massachusetts to where you are now, and some of the lessons you've learned and that we can learn and that plans need to really think about. And I think for all of us listening to you, Eugene, I think it really follows very nicely with the challenge we heard from our terrific opening speakers. Right. So I just want to thank you for everything you're doing in the industry. Thank you for joining us, and thank you all for being here this morning.
Thank you.